It has been more than 2 months since the Tokaimura Criticality Accident, and morale among the three medical teams, each treating the three patients exposed to massive doses of neutron and gamma radiation, is varied. One is expecting a release from hospital shortly, one is hoping their patient will make a full recovery, and one is expecting it all to end soon. The medical battle continues. It was the 1st of December. While the severity of bleeding began to decrease, so did the amount of white blood cells present in Ouchi's body. It was down to 7,700 cells per cubic millimeter of blood. Another problem was discovered, this time in Ouchi's blood. As a result of liver's failure, white blood cells known as macrophages, or phagocytes, multiplied abnormally to replace the role of the liver in the metabolizing of lipids. This abnormal multiplication resulted in them suddenly attacking healthy red blood cells and other white blood cells. This is known as hemophagocytic syndrome, and is lethal to 80% of sufferers within 5 years. Drugs surrounded by lipids were replaced, as were any that could potentially impact Ouchi negatively. On that day, as it had been since the cardiac arrests, Ouchi's consciousness read E1-VTM1/GCS. Under the Glasgow Coma Scale, 1 is the lowest possible level. While his voice was impaired by the tube, his eyes and motor functions could be determined. Ouchi would not open his eyes at all, whether it be to command or in response to pain. Similarly, Ouchi did not move his body at all, despite being in what had previously been an uncomfortable position for him. Still, the nurses would talk to him. "Mr. Ouchi, it's time for the nurses to change shifts. We're starting the intravenous drip. We're going to wash your eyes. It's nice out today. It's really cold out today. Winter is almost here. Spring will come." They all talked to Ouchi under the belief that, though he could not move or respond, he could always hear them. Even Meikawa participated in this, saying, "Good morning, Mr. Ouchi," at the start of his shift. Meikawa was not only present as a simple leader of the team of nurses, but also participated in the dressing changes, skin disinfection, and administering the medication Ouchi simply required to stay alive. Every night, he would analyse the data collected single-handedly, looking for any improvements Ouchi had made over the day. The 2nd of December. Bleeding in Ouchi's intestines worsened again. A potential new wound had manifested in Ouchi's intestines. Despite the massive volumes of transfusions, Ouchi was still losing greater volumes of blood, 10 litres in all per day. This was not helped by the fact that skin grafts transplanted to Ouchi were floating off due to the surrounding blood loss. All attempts to apply new grafts were stopped. In order to maintain Ouchi's blood pressure and pulse, 3 vasopressors, drugs that raise blood pressure, were being used. Dopamine hydrochloride, dobutamine hydrochloride, and norepinephrine, all of which combined were able to keep it within a relatively safe blood pressure level and a pulse of around 120 beats per minute. However, any attempts to reduce the dose of these medications would result in Ouchi's blood pressure and pulse declining. He was dependent on them to stay alive. On December 3rd, plasma exchange began, as the simple administering of fresh frozen plasma was not suitable. Blood is removed from a vein and then separated into blood cells and plasma. The old plasma is disposed of, and the blood cells mixed with fresh frozen plasma, and then it is returned to the body. As a result of the hemophagocytic syndrome, his white blood cell count had decreased to 5,400 cells per cubic millimeter of blood, and it was continuing to decline. The next day, the white blood cell count dropped to 5,200. While plasma exchange continued, the issue of hemophagocytic syndrome and bleeding from Ouchi's skin and digestive tract resulted in transfusion of blood into Ouchi becoming a constant procedure, most of which would exit Ouchi's body through the festering wounds within hours, unable to clot the wounds that covered Ouchi both inside and out. December 6th, another day of plasma exchange, and the process was set to continue. Compared to the drop of 1,000 white blood cells that he had seen in the previous few days, the drop on that day was even worse, 1,100. Ouchi was now down to 3,100 white blood cells per cubic milliliter of blood. For comparison, a healthy person should have between 5,000 and 8,000. At such a low level, Ouchi was again at risk of viral infections, taking the opportunity of the low levels of white blood cells and causing even more damage to his internal organs than that caused by radiation poisoning. The small intestines were completely filled with a mixture of gas from Ouchi's ileum and blood to the point of which they were severely inflated beyond their normal size. December 7th. At 3 p.m, his blood pressure declined without warning to roughly 100/50. While this may have been ideal for the average person, it suggested Ouchi had insufficient circulation and had gone into shock. In order to bring it back up, Ouchi was administered another cardiotonic drug, bosmine, and a strong antibiotic called vancomycin. The medical staff were certain that bacterial infection had caused Ouchi to enter shock. The result of this was Ouchi's body being placed under too much stress, and plasma exchange could not continue. Ouchi's white blood cell count declined again to 2,200. Day 70 of treatment. Ouchi's blood cell count halved to 1,100. Shock continued to have an impact on Ouchi, and his blood pressure was fluctuating, despite the use of bosmine. Yet another issue was identified. Due to poor circulation, Ouchi's cells were not receiving enough oxygen. In order to respire, they were doing so anaerobically, producing lactic acid. Now it was leaking into his blood. The acidity was increasing dramatically. Ever since the 3 cardiac arrests, multiple tests were conducted to analyse potential nervous system damage that had come as a consequence. One of these tests was that of the pupillary light reflex. A light was shone into Ouchi's eye, and if the pupil constricted, or if there was any constriction at all, it would be confirmed that this reflex still worked. While one doctor couldn't identify one, Meikawa did. Hence, it was considered uncertain in medical charts from December 3rd. Ever since the cardiac arrest, the artificial respiration apparatus was changed from assisted spontaneous breathing to forced breathing without spontaneous breathing. Any spontaneous breathing would be detected and assisted. However, it gradually declined and eventually was no longer detected. There was no way they could treat Ouchi with the medicine they possessed at the time. The most they could do was to replenish lost fluids and replace failed organs with new ones. However, if one of the remaining organs failed, Ouchi would most likely die. All of this was building up to Meikawa making a choice, weighed down by defeat and frustration. On the 10th of December, Ouchi's white blood cell count plateaued at about 1,100, possibly due to the acidity of his blood. However, the acidity did improve slightly. Blood pressure continued to fluctuate, with no sign that it was going to stabilise. The loss of blood through Ouchi's digestive tract was increasing, and so more blood was transfused continuously into Ouchi's body. By the 15th, his white blood cell count had fallen back down to 1,000 per cubic millimetre of blood. Still, the amount of fluid loss remained at 10 litres of blood per day, all of which had to be replenished with new blood. Gradually, the reports released to the public stopped mentioning the loss of fluid from Ouchi's body, and the people who read them never learned of the issues surrounding Ouchi's decline in health. The next day, all positives were dashed as the white blood cell count fell dramatically to 600. Aside from that, there was a little change. Through the use of technology, they were able to confirm that no viral infections had entered Ouchi's body. Still, his blood pressure fluctuated up and down, unable to remain stable in such a volatile condition as blood was heavily transfused. On the 17th, his white blood cell count again declined, this time to 500. At this point, his blood pressure began to trend downwards, fluctuating lower every time. Similarly, his pulse declined from 120 beats per minute to roughly 100 beats per minute, and continuing downwards slightly with every hour. This decrease in body circulation allowed the mould growing on his body to spread to his arms. Day 80 of treatment. His white blood cell count was now at 400. Eventually, it would reach zero, and the hematopoietic stem cell transplant would have been considered a conclusive failure. They would be unable to perform another, as the loss of fluid out of Ouchi would prevent the grafts taking. It was found out that day that the amount of sedatives used on Ouchi to keep him from feeling pain was far exceeding the range they could use for treatment, and that this could have been causing Ouchi's inability to respond to pain or open his eyes. A test of Ouchi's central nervous system was, resultantly, scheduled for December the 20th. On December 19th, there was no change in Ouchi's condition, and Meikawa was left disheartened by it. All they had done was simply ineffective against the symptoms of radiation sickness. Defeated, frustrated, Meikawa came to the realization there was nothing else they could do. They could not go forward in treatment, nor could they regress, and he made his choice about what to do next. At 11:30 p.m. that night, the 81st day of treatment, Meikawa collected together Ouchi's wife, parents, sister, and her husband, and his uncle, while Ouchi's son slept unaware of the meeting. Each took a seat in front of a monitor, and Meikawa showed these people who would never give up the true situation Ouchi was facing. His blood pressure was fluctuating wildly, and the maximum amount of vasopressors to raise it had been reached, meaning if it trended down again, they could not stop it. The medication Ouchi was receiving was causing blood to leave his extremities, such as his hands and feet. The remaining skin on his fingertips had blackened. Once he had gone through this in depth, he turned to the family and said to them, "The next time his heart stops, I think it's best we don't administer resuscitation." After a few moments, the family said, "We understand." Finally, they had revealed their despair over Ouchi's condition. When asked if they had any questions, they responded with silence. When the meeting had concluded, it was the 20th of December. Recorded in Ouchi's medical chart was the phrase, "DNR determined following one therapy." In other words, the family had consented to preventing Ouchi being resuscitated the next time his heart stopped. That day, his blood pressure continued to trend downward, without signs of stopping. His white blood cell count had increased to 600 per cubic millimeter of blood. However, now mould was starting to grow on Ouchi's groin. The test regarding Ouchi's central nervous system was not carried out. At 5:30 p.m, Ouchi's wife, father, and sister visited him. His wife simply said one thing: "I want you to make it to the year 2000, something she had said previously to him. They had folded roughly 10,000 paper cranes in the waiting room. December 21st, 1999. Day 83. Blood pressure was continuing to trend down. However, Ouchi was absorbing more oxygen through his lungs. His white blood cell count again increased, this time to 800 per cubic milliliter of blood. At 3 p.m, his wife, mother, father, sister, and uncle all visited. They gathered in the room and then asked to have a look at his face. Ever since his face was first covered, it had not been removed in the presence of his family. However, as Ouchi's condition continued to deteriorate, they wished to have one last look, out of fear they would never see it again. The nurses complied and replaced normally used gauze with a thinner one. When his face was shown to his family, they all began to cry. Several of the nurses handed them gauze to dry their eyes, and the family explained that they chose not to cry in his presence because it would make Mr. Ouchi worry, him being a worrywart in their opinion. They were glad to see it, however, based upon the explanations given by the doctors, expected it to be blacker. That night, at 9:35 p.m, Ouchi's pulse, previously in the hundreds, crashed down into the 60s, and his blood pressure also declined into a low state. All medical personnel were on standby for it to drop again. At 10 p.m, his wife and son visited. His son called out, "Father, hang in there." This was the last visit. 30 minutes later, Ouchi's pulse fell, and his blood pressure began to fluctuate. Physicians entered at once. Multiple drugs were administered. Those given had no effect. His blood pressure stopped fluctuating and plummeted sharply. The medical team realised that this was the end and hurried to contact his family so they could say goodbye. They did not reach the room in time. Hisashi Ouchi died at 11:21 p.m, December 21st, 1999. He was 35 years old. At 4:03 a.m. on December 22nd, the autopsy of Hisashi Ouchi began. This was led by Shogo Misawa of the University of Tsukuba. However, more than 30 people had gathered for the autopsy, including Meikawa and the medical team who treated Ouchi. Between Ouchi's death and the autopsy, Ouchi's body had been cleaned entirely, and the intravenous strip in his neck removed. To Misawa, the body appeared like nothing he had seen before, even though he had performed at least 3,000 individual autopsies. It was bright red, appearing burnt yet not black. Blood smeared the front side of the body. In contrast, Ouchi's back housed skin that was intact, and while appearing normal, had lost all of its melanin, turning an extreme white. The autopsy began with the usual cue. Let's start the dissection. With that, the scalpel entered Ouchi's midsection, cutting into Ouchi's muscle and exposing Ouchi's digestive tract. The intestines and stomach had been completely destroyed. Mucus had been eroded away as the cells died, replaced by clots of blood. In the stomach was a mass of blood clots weighing 2,040 grams, and a total of 2,680 grams of clots in his intestines. Tumour cells were developing in the intestinal tract as well, showing how much damage occurred to his intestines. Ouchi had also been suffering from respirator brain in his final days. His brain effectively liquefied in his skull. A mercy, perhaps, as even if he did consciously survive the heart attack, his brain functions would have been lost soon after. Analysis of Ouchi's muscle cells showed they had lost all of their fibre. The only parts remaining were the cell membranes. Even the nucleus of each of the cells had been destroyed. This was true in all but one case. Ouchi's heart. The heart muscle was almost completely intact, despite all the muscle and bone surrounding it being completely destroyed by the consequences of radiation exposure. There is no certain explanation for this. Some theorize that the medication used to treat Ouchi prevented the damage from manifesting, while others suggest it was Ouchi's will to live that kept it going through the damage that attacked every other cell in his body. At 8:37 a.m, 4.5 hours after the autopsy began, the final examinations were completed. The cause of death was recorded as multiple organ dysfunction, primarily or secondarily provoked by exposures to high doses of radiation. Afterwards, Ouchi's body was neatly coated in dressings and moved to the morgue. The physicians who had cared for him through those final days of suffering wept as they accompanied him. At 9:45 a.m, Ouchi's body was carried to the hearse, his wife inside. A bouquet of flowers was placed atop this, paid for by the medical team, and they left the hospital for their hometown in Ibaraki. The funeral was held on Christmas Day, 1999. Hisashi Ouchi's battle was finished. As for Shinohara, his was far from over. As the days progressed, Shinohara's fever worsened and rendered him unable to sleep, leaving him exhausted and drowsy. In order to treat it, the medical team prescribed him steroids, which also helped to reduce inflammation. However, this was discovered to be having an adverse effect on Shinohara's liver, which was damaged under the strain of the medication. Furthermore, by that day, skin change was now present across the entirety of Shinohara's body. Under peeling regions, a fresh layer of skin was still present, yet partially damaged. It would bleed easily, and so, as a result, Shinohara underwent a blood transfusion on December 3rd to recover lost cells. Despite all these issues, Shinohara remained in good spirits, with the doctors convinced they could indeed treat him. Furthermore, the epidermis was starting to recover, despite the fact portions of it were beginning to bleed more and more frequently. On December 6th, a significant bowel movement was felt, and Shinohara felt pain from it. However, this subsided gradually. Further bowel movements were felt in the future, and so Shinohara's pain worsened. The medical team performed calculations and realised that 67% of Shinohara's body was subject to second-degree burns. Something had to be done about it. Shinohara was not losing as much blood as Ouchi. Skin grafts would take much better to Shinohara than they had to his work colleague. The first ones performed were on the 18th of December, involving grafts to his legs. These were a success and took to his body. This surgery was performed under general anaesthesia. By December 20th, the old layer of burnt skin on Shinohara had completely fallen off, leaving a fresh layer behind. However, even this layer was peeling, and there was no new skin under this. 2 days later, on the 22nd of December, Shinohara was informed of Mr. Ouchi's passing. Shinohara cried twice that day, first for the loss of a friend and a colleague, and then for himself and the future that awaited him. He asked the medical team, "Am I going to die too?" "No, your condition isn't as bad as Mr. Ouchi's. You'll get better." These phrases of encouragement helped to retain Shinohara's good spirit. Meanwhile, his wife said, "When you get better, let's go pay our respect to Mr. Ouchi's family." On the 28th of December, Shinohara was given further skin grafts to his arms, which also took. The lack of a white blood cell donor had helped Shinohara in this case, as the crippled immune system prevented the skin grafts from being attacked by the white blood cells, without the use of immunosuppressants. 2 smooth operations had been performed, and Shinohara was on the way to recovery. On New Year's Day, 2000, Shinohara was indeed healthy enough to leave the room in a wheelchair, and was escorted to the garden of the hospital in said wheelchair. Such was his significantly improved condition, gifted by skin grafts. Shortly after this, Shinohara lost his ability to open his eyes. This proved a matter of discomfort and annoyance to Shinohara, as shortly thereafter he also lost the ability to move his hands and feet. It initially became a source of discomfort, and then something he hated. In December, Yutaka Yokokawa had recovered to the point he could be discharged from the National Institute of Radiological Sciences. His white blood cell count was higher than it had ever been since the start of the ordeal, and while the growth of his hair was limited, it was returning. On December 20th, Yutaka Yokokawa left the National Institute of Radiological Sciences and returned home, monitored carefully. At this point, Much of the news regarding the accident had blown over, and so Yokokawa found himself able to watch television and read the newspapers in relative calmness. The following night, December 21st, Yokokawa witnessed the announcement of Hisashi Ouchi's death on television. He cried all night for the death of his colleague. In the future, Yokokawa returned to NERS in January, April and November of 2000 and June of 2001 under the advice of the medical staff there. These stays were 2 days long and allowed him to undergo a number of treatments to check his progression and ensure he was not going to become subject to further symptoms of radiation sickness. These included a complete blood cell count, serum chemistry, hormones and some tumour markers, analysis of lymphocytes, some bone marrow tap and urinalysis. He also visited an ophthalmologist, cardiologist, dentist and psychiatrist to ensure every part of his body was doing well. It was found that Yokokawa had suffered a retinal hemorrhage in January of 2000 and again in June of 2001. These, however, were a consequence of Yokokawa's diabetes and not a result of irradiation. The hemorrhages proved minor and were treated easily. Furthermore, his high blood pressure and diabetes became much more pronounced. In his guilt and depression, blaming solely himself for the death of Hisashi Ouchi and his colleagues' medical struggles, he had put on weight, more than 8 kilograms in half a year. And while his hair had recovered, minor skin defects still plagued him. For Yokokawa, his battle against radiation sickness was over. The accident had been contained and the cost for Japan tallied. The outlook was grim, and wrongdoing had occurred.